It's a pathological condition. It should be immediately examined. And if there is tight frenulum, when the skin is pulled backward, there will be crack. Extra heat around the testis may cause oligosperm. All the 100 seeds will not go into plants and they become, every year there will be drop of fertility by, and even for the man after the age of 50 or 60.
Doctor, what does it mean if somebody has an abnormal large testicle?
It's a pathological condition. It should be immediately examined and scanning has to be done and rule out the tumor or collection of the fluid, hydrocele, or a cyst inside the testis. So it is really a serious medical and surgical condition. It calls for scrotal scanning, immediate scrotal scanning.
Can this be life-threatening?
Yeah, if it is a cancer, if it is a tumor. Testicular cancer is quite common. Amongst the cancers, testicular cancer and prostatic cancers are commonest. So it requires immediate attention. Any lump anywhere in the body, it has to be taken seriously. Unless otherwise proved, they are dangerous.
Yes, exactly. So the next question is, the skin on the tip of my penis tears sometimes when I have sex. Is this normal?
You know, that's what it is. Phimosis, I told you, no? It is when there is tight foreskin. When the skin is pulled back, then it will cause some small tears because it is tight. And if there is tight frenulum, that is the attachment of the glans penis to the prepuce, if it is tight, when the skin is pulled backward, there will be cracks. So this requires further examination, find out whether there is phimosis or tight frenulum, and it requires for corrections, surgical corrections.
All right. Moving on to fertility-related question. This is something that you have discussed before, but because they've asked, I'm going to ask you again. How does heat in my genital area affect fertility? The question is asked by a male.
Yeah. In the last 3 lectures,
so
please send him the connection of the last 3 lectures. That is pre-testicular cause, testicular cause. So all those 3 causes, I was telling that the heat, extra heat around the testis may cause oligosperm. So ask him to keep his testis cool.
Is fertility or infertility genetic?
See, about 10% of the couple who are infertile, they have some genetic problem, either in the sperm or in the egg. So fertilization will not be occurring due to genetic incompatibility. There will be some chromosomal problem or problems in the genes. For example, in the men, in the Y chromosome, there will be some deletions in one of the chromosome, in one of the gene will be missing, or it will be damaged. So that causes some infertility. Likewise, the eggs produced, that is the oocytes produced from the lady, that is from the woman, it may not be able to be fertilized with adding the sperm even by injection, even by ICSI, even by intracytoplasmic sperm injection into the egg. The egg may not become zygote, or it may not be able to become the embryo. That is the failure of the fertilization. Just like when we have 100 seeds, when we throw the 100 seeds into the field, all the 100 seeds will not go into plants and they become trees. Like that, there may be some genetic problem in the eggs or in the sperm, which prevent them to be fertilized and become a full-fledged embryo and full-fledged fetus and a well-born baby. So genetic problems will be there, and it accounts for about 10% in the infertile couple. I'm not talking about the general population. So do not mistake for the general population. We are talking only about the infertile couple. In the infertile couple, we see genetic problems more than the general population. General population, we don't observe them at all because they are happy with whatever they have and they never come for any tests.
One more question. This is asked by a male. My sperm count is just a little above 15 million, but my wife has PCOS and we are both 36 years old. What are our chances of getting pregnant naturally?
Yeah, after the age of 30 in the woman, every year there will be drop of fertility by about 5 to 10%. So by the time they reach 40, the fertility would have come down by 50%. So after 35, the fertility would have come down by about 20 to 25%. So as the age advances, fertility goes down, especially after 35. Every year there will be drop of fertility by about 5 to 10%. So they have to take the matter seriously and see that they achieve pregnancy either by one of the techniques, by IUI or IVF. Do not delay further. Because as the age advances, that fertility comes down because the eggs get old, and even for the man after the age of 50 or 60, the sperms become old. They may not be able to fertilize the egg. So age is an important factor, especially for the female. For the men, it's okay. Up to 40, 50, it's okay. But their fertilization capacity comes down as the age advances because the sperms and the oocytes, they undergo degenerative changes as the age advances. They may look normal when we see through the microscope, but their power of getting fertilized may decrease as the age advances. And even genetic abnormalities after the age of 35 or 40 will be more in both the men and women. That is because of the aged parents, when they reproduce, the chances of the offspring getting some genetic abnormality will be more than the people who are young, that is below 30. So my advice is let them go for one of the technique and get pregnancy as quickly as possible.
The last question for the evening is by a male, and he says, I am into bodybuilding and take a fair amount of protein drinks. Will this affect fertility?
No, it won't affect, but taking unnecessary steroids, anabolic steroids, and doing severe exercise may sometimes reduce the sperm count. So very severe exercise, what happens is the testosterone level increases beyond certain limit, and it may have boomeranging effect, negative feedback effect on the brain, and it may liberate inhibin. That inhibin will stop the production of FSH, and FSH, which is very important for spermatogenesis, may come down. So severe exercise, severe gym, or severe bodybuilders, especially if they take the anabolic steroids to build their muscles, that may affect the fertility marginally. But that itself may not be the main cause for infertility. So those who are building a body, better they preserve their sperms in the semen bank, so that if due to some reasons if the sperm count comes down, they can use the semen from the sperm bank.
Got it, sir.
They can stay with the store. Okay. But the effect of bodybuilding and taking proteins may not directly affect the fertility. So one need not worry about it unless they are so serious bodybuilders to become Mr. India or Mr. World, daily spending 6 to 8 hours in the gym. That strenuous exercise, it will definitely affect. But routine bodybuilding, that is about spending about 30 minutes to 1 hour in a gym, definitely it will not cause for any alarm regarding the fertility is concerned. Let them go ahead. And in fact, it is good to have exercise.
So unless you are heavily into muscle building and take steroids, bodybuilding and taking a amount of drink will not really impact fertility. It will only impact.
Routine gym is very good for health.
All right, then. Thank you so much for your time. And I'm looking forward to discuss the other topic the next time.
Yeah, sure. So it was a panorama of questions, so many, and it's an eye-opener for us, what the public will be thinking about the sexology, so that we can prepare the lectures so to suit the questions, so that it will be more helpful for the general population as well as for the other doctors, the doctors who are not in the profession of sexology or urology. So it will be useful for the general doctors also, and also for the general public also. Thank you very much for the opportunity to share my views about this subject. Look forward to meet you again. And
thank you so much, Dr. Sharath. We wish you the best as always from Subhat Health Tech.